Why is this happening? Why would something like the Center for Disease Control, ask doctors to fudge numbers to inflate the COVID-19 related deaths? I mean, on such a mass scale and at such a high level.
Yeah, well, I'm certainly not advising the CDC how to proceed. So whatever I say would be somewhat speculative on my part. But in looking at what I do know about the CDC, one thing is that it is mostly funded actually by private industry. So there's something called the CDC Foundation, and you see that all of the major companies that represent the healthcare industry, such as pharmaceutical companies, health insurance companies, medical device companies, et cetera, are the financiers of the CDC. And they certainly have a lot of profit to gain based on having a serious pandemic and needing to sell vaccines or testing kits and things like that. I think the hospitals are in a different position financially right now. But it seems that all of the policies that they've initiated would have to be for the immediate purpose of inflating the perception of the health consequences of this COVID-19 situation. But it's definitely not grounded in reality. When I was in my 20s, I had a job for a couple of years. I was working for the New York City Department of Health, and it was in a CDC-sponsored position called a public health advisor. And my job was actually to go to hospitals and clinics around New York City and review charts to identify cases of AIDS. And I remember at that time, there were very specific criteria that had to be met in order to qualify a case of AIDS. And I would have to hunt down a lot of information in order to find out if the criteria was met. And if it was not met, I couldn't report it as an AIDS case. So the way that they are instructing people to report COVID-19 cases is a total departure from that approach. And it's very unscientific, and it's fraudulent in my opinion.